Mosquitoes transmit a wide variety of viruses, including West Nile, Zika, and dengue, by feeding on the blood of both infected and healthy humans. Out of all the mosquito-borne diseases, dengue is of particular interest because of its reemergence in many areas of the world. The Philippines have been facing a national dengue epidemic during the year of 2019, with currently over 200,000 cases and 1,000 deaths. Dengue fever, or breakbone fever, causes severe muscle and joint pains, high fevers, and in the most severe cases, hemorrhaging. The only current prevention methods of this horrible disease are a new vaccine and mosquito control. Unfortunately, the vaccine has struggled breaking through to the public market, and the most effective mosquito control, insecticides, harm the environment. Mosquito range and behavior is also heavily dependent on environmental conditions. They prefer tropical climates and standing water to lay eggs in. Therefore, this problem requires a One Health approach because of this complex interplay between animals, vectors and hosts, human health, and environmental conditions.
Since the current epidemic is a One Health problem, a One Health team is needed for this case. Doctors, nurses, an epidemiologist, a weather analyst, and a local would be critical for this team to help find a solution for this epidemic. Stakeholders in this case are the government, since a national health emergency is affecting their public, and local, since many of the local people are dying from dengue. A bottom-up approach for this problem would be to educate the locals on prevention, symptoms, and possible treatment options via free meetings, flyers, brochures, and school speakers. Since storms are one cause of an increase in the number of mosquitoes, it is vital to learn post-hurricane personal protective equipment training, or PPE, since it is essential in preventing mosquito bites. Another possible solution would be to educate communities on removing stagnant water after hurricanes by leveling grounds and cleaning gutters.
Top-down initiatives to resolve current and future dengue outbreaks should rely on the Philippines' existing disaster response infrastructure. We propose to engage the national government's National Disaster Risk Reduction and Management Council, or NDRRMC, to direct focused, coordinated usage of local government's quick response funds. This top-down direction will permit a unified approach to reduce the severity of the current dengue outbreak and build resilience against future outbreaks. We propose the assembly of limited but specialized teams that carry out CDC-recommended integrated pest management strategies. Teams will be on standby year-round and be deployed after periods of heavy rainfall or during dengue outbreaks. These teams will drain small pools of standing water, distribute mosquito nets to civilians, apply larvicide, and spray ultra-low volume adulticides.
One roadblock to dengue prevention in the Philippines is vaccine efficacy. Dengue Vaxa, the first dengue fever vaccine, was introduced to the Philippines in 2016. Controversy surrounding the vaccine arose when the deaths of many people occurred after a nationwide vaccine program. The manufacturer discovered that the vaccine can only be given to people who have already had dengue. The Philippines decided to stop the vaccination program, but the fear around this vaccination crisis will present a significant roadblock when the program is reintroduced. Educating community members can resolve this roadblock. The leaders will become ambassadors and hold informative community meetings on the safety of vaccines, reducing fear of vaccines in the Philippines.
To prevent dengue from harming the Filipino population, multiple vaccine clinics will be established throughout the country in various regions. With these vaccine clinics, we will be able to prevent dengue fever by triggering an immune response to 4 different dengue viruses. In order to encourage the population to get these free vaccines, officials and volunteers will be informing the community and its leaders of the dangers and effects of dengue.
Another way to prevent an outbreak besides educating the public is finding the root of the problem. Get rid of the habitable environments for the mosquitoes. The Philippines has extremely poor infrastructure, so there are areas that people have little control over, like homes in the slums with large bodies of water from heavy rainfall. Since big problems like that are not and should not exclusively depend on the people who live by it, the public health system in the Philippines should be called for help. Funding is a top priority because individuals can't combat this problem within their communities. The best way to approach this is through a top-down approach because only the people in power can make the biggest difference in eradicating this epidemic. We should hold the government accountable for more funds that can go towards communication efforts and proper ways to better the water infrastructure system as a whole.